righty. Good evening, everyone. Welcome to the COVID-19 vaccine virtual town hall for parents. If we can just slide over to the next slide. Bienvenidos a todos. Quiero empezar con un breve anuncio. El día de hoy tenemos interpretación en español que será en vivo. Para conectarse por Zoom al modo de interpretación en español, favor de hacer clic en la banderita donde dice English o inglés y seleccione Spanish o español para su idioma. Desde su celular también puede hacer clic en More o Más, donde aparecen los 3 puntitos para seleccionar el cambio de idioma. Igual aquí en la pantalla se aparecen los módulos que va a seleccionar en su pantalla o en su celular para cambiar de lenguaje de inglés a español. Entonces vamos a dar unos momentitos para que las personas se puedan conectar a modo de español si necesitan ese cambio. Just giving everyone just a moment or two for those that need to switch over for Spanish interpretation. It's just letting folks know in Spanish what it is that they need to do. So we will get started in just a second. Perfect. All right, we can go to the next slide. Well, good evening, everyone. My name is Roxana Garcia Ochoa, and I'm one of the program directors at the Health Education Council. Our organization is a nonprofit that aims to cultivate the health and well-being of underserved communities. And we do this by leveraging the power of collaboration, not just with the community, with different partners, and with each other to reach our mission. Next slide. The Placer Community Foundation is one of the proud sponsors of this event tonight, and they are a public charity established to assist donors in building an enduring source of funds to meet the changing needs and interests of the community. We would also like to thank UC Davis Health for their commitment to serving the community through education and service across the greater Sacramento region. Next slide. We would like to share a couple points before we begin today's discussion. We really want to hear from you today. Although we're in a webinar format, we really encourage you to put your questions in the chat box over the course of the webinar. As your facilitator today, I will make sure that I'm reading the questions as they come through the chat box and also let the doctors provide their responses. We also appreciate the questions that were submitted prior to the event during registration, and we will be sure to answer those today. All questions are welcome because the truth is, if you have a question, someone else probably has that same question and has been wondering that. So please put your questions in the chat. No question is a wrong answer. Next slide. But I also will note we are recording this as you accepted upon entry, and we are streaming this live via Facebook at our page at Health Ed Council. But before I introduce our speakers, we really would like to get to know a little bit about the folks that are in the audience today, and we would like you all to answer the poll, which will be streamed in just a moment on the Zoom. We would like to know on a scale of 1 to 10, how likely you are to vaccinate your children, with 1 being no to very unlikely and 10 being yes to very likely. So we'll give folks just a moment. Poll is open. You should see the bar with those options on your screen. And again, starting at number 1, it's no to unlikely. Number 10 is yes, you are likely to vaccinate your children or child. All right. Michaela, do we have the majority of votes in to close the poll? Should we give folks another minute or two? Great. So the majority of folks, well, we do have a couple responses on the call. There are about 5 folks that said that they are still unlikely, on the unlikely side to vaccinate their children. But there are a number of folks that did share 5 responses from 5 to 10. So we really hope that your questions are answered throughout the presentation today. And again, please pose those questions throughout the presentation. Next slide. We are so happy to have two professionals from the University of California, Davis with us. I will start with introducing Dr. Mark Henderson, who is a professor of internal medicine and associate dean for admissions at the University of California, Davis School of Medicine, one of the most racially and ethnically diverse schools in the United States. He's an internal medicine specialist who has done medical work such as vaccination campaigns in several Latin American countries, including Nicaragua, Costa Rica, and Paraguay. Dr. Henderson leads the UC Davis Community COVID Vaccination Team, which is charged with providing outreach, education, and vaccination to members of the local Sacramento community. And I'd also like to welcome Dr. Douglas Gross. Dr. Gross has been at UC Davis for 41 years with appointments in the Department of Cell Biology and Human Anatomy and the Department of Pediatrics. He teaches gross anatomy to medical students and undergraduates and sees pediatric patients at the University of California, Davis Medical Center here in Sacramento. He has been involved in multiple global health projects in Africa, Central and South America, and has worked with World Health Organization to help reduce infant and child mortality. He's a member of California's federal disaster medical assistance team, rapid response team trained to supplement local medical care in a disaster setting. And has deployed in an aftermath of Hurricane Katrina, Typhoon Haiyan, and in the Philippines, and the earthquake that happened in Haiti, and the Hurricane Maria in Puerto Rico. His experience in Haiti led him to become a founding director of the UC Haiti Initiative, and currently is the co-director of a program to improve pediatric care at the Haiti State University Hospital. He's also the medical director of UC Davis's new student-run free clinic, River, a mobile pediatric clinic that will provide school-based comprehensive medical services directly to communities in need. So I will turn it over to Dr. Gross and Dr. Henderson, who will now dive a lot deeper into all the questions that folks have about the COVID-19 vaccine. So I'll turn it over to you.
All right, thank you so much. And what I'm going to do is, if this all works properly, I'm going to put up a short presentation about COVID and especially about its impact in children, to get everybody kind of on the same page. And then once that's over, we'll pretty much open this up and the remainder will be a question and answer session. So let me go ahead and share this screen. And let's see, I need to. All right. Hopefully everybody can see this. The other panelists, is this showing up on your screen? I just want to be sure. Okay, good. So actually, let me go back. We've skipped ahead. Sorry. Not sure how to. Okay. So what this first image shows is simply a sort of cartoonish view about what this coronavirus really is, so that we understand what we're dealing with. And the coronavirus is a very simple kind of organism, and it has some genetic material in the center, and then it has a little sort of surrounding membrane, and sticking out of that membrane are these little spiky structures. Those spikes are made of proteins, and it's those proteins that allow this viral particle to attack our cells, especially in our respiratory system, and make us sick. Those spikes and the proteins that those spikes are made of are also what the vaccines are basically directed against. So what happens when you are exposed to that virus, you basically breathe it in and it enters the cells in your respiratory system. And then two things happen. One is the virus can directly damage the lungs and the lung tissues. And the other is your body recognizes that virus as something foreign and it tries to destroy it. Unfortunately, that response to the virus can also end up damaging your lungs and your respiratory system. And that's what basically makes us sick. One of the main features of the disease is problems breathing. And this is what causes the really serious consequences of being infected. And this just shows how our lungs are made up. Our lungs are a series of tubes that the air passes into. And at the very end of those tubes are little tiny sacs. And that's where the air that we breathe in gets into our bodies. And with this disease, those small air sacs get very much damaged and filled with fluid, and it doesn't allow the air to get from the air that we breathe in to get into our bodies and into our blood. And so we don't have enough oxygen, we don't have enough air, and this makes people very, very sick. So that's what happens when you get the disease. The vaccine that we're talking about is actually a different vaccine than all of the vaccines that all of us as adults got when we were children. And it's made from the genetic material in that virus. And so we have the ability to take the genetic material that makes those proteins in the spikes, the little things that stick out that allow that virus to enter our cells, make a vaccine. And when that's injected into you, that is injected into your arm, your body then recognizes those spike proteins as something foreign and will make a response to that and try and get rid of that. And that will basically inactivate those proteins, which will keep the virus from entering your cells. And it essentially blocks the ability of that virus to get into your system and cause disease. And it's done with this genetic material that's called messenger RNA or mRNA. So you'll often hear these terms that it's mRNA vaccine. That simply means that it's made from this genetic material of the virus. And the significance of that is that there's nothing in the vaccine itself that enables the virus itself to cause disease. So the vaccine is completely unable to cause any kind of disease. It simply allows our body to produce these proteins, and then our body recognizes those and destroys them and prevents the virus from entering our body. So that's in a simple way how the vaccine works. Now, this is an old slide, and I don't like looking at graphs like this any more than most of you do. But what this showed is early on in the infection, the percentage of people in the United States that had serious illness with COVID. And early on, what you can see is the 0 to 17, the children, was a very, very small number of people getting COVID disease, or at least we thought they were. And that the older you got, the much higher incidence of disease there was. Well, it turns out that that's not at all true. That's what we used to think. And a lot of people still have that impression that COVID is not a disease that affects children. So why do we want to expose them to this vaccine when children aren't getting the disease? They actually are. They probably were from the very beginning, but children not infrequently don't have symptoms when they get the disease. And so they weren't being reported. And that the incidence in children has now been much more well recognized, and we now know that the incidence in children is increasing dramatically, especially over the last few months. So this becomes especially important when we consider the fact that we now have a vaccine. All that this slide shows is more recent information. And what this is showing, this starts way back in last March, and it's just showing the number of cases. And what you can see, this is October of this year, so basically 2 months ago. And you can see that recently, the number of children either ages 5 to 9, 10 to 19, or all the way from 5 to 19, the incidence of those has dramatically increased over the last few months. So many, many, many more children are being identified as getting COVID. So this is not just the disease of adults, that children are probably the most rapidly increasing part of the population who are getting this disease. And so the protection from the vaccine becomes especially important. This is just some of that information. What this shows, is that we think that the risk of getting the disease now in children that are 5 to 17 is pretty much the same as the risk in most adults. How many children have confirmed COVID infection in the United States so far? 6.2 million. 6.2 million children have gotten COVID. So again, this idea that this is not a disease that affects children is very, very much wrong. What happens to them of those 6.2 million? About 2% are hospitalized. About 0.03, very few die, but they do die. There are children that die from this disease. That's significantly less than adults. Fortunately, in children, they do better, but there still are many, many children who are getting sick from this disease. Just this year, so we're at the end of 2021 right now. This year in 2021, COVID has killed 900 children under the age of 18. And as I showed you, that rate is increasing rapidly. We estimate about over 1 million new COVID cases in children have happened just since the beginning of September, so very recently. And children now represent about 20% of all the cases. And over the last 2 months, about 1 out of 4 of all new infections in the entire United States has been in children. And in just August, the last month where we have really good information, 30,000 children were hospitalized with COVID. So what you can see is that this idea that COVID is not something we need to worry about in children is simply flat out wrong. We just weren't recognizing early on that it was affecting kids. And so I think I'm going to stop sharing. Let's see how I get this out of here. Stop sharing. Okay. And move on to perhaps allow Dr. Henderson to make any comments he would like to make now, and then simply open up to questions and answers. But I hope that sort of sets the stage for what we want to, the information we want to get across.
Thanks, Dr. Gross. I would add one important point about infections in children, and that is that because there are so many children that aren't vaccinated, it provides a big reservoir or pool of COVID that then can spread to their relatives. And by that, I mean their grandparents, uncles, aunts, who are even more likely to die or be hospitalized with COVID. So there's a protection that occurs when children don't get COVID because it protects their older relatives. So if you look at countries like Spain and Portugal, who have vaccinated their teenage children many, many months before we did, their whole population is doing better in terms of COVID. They have falling rates of COVID in their countries instead of rising rates. And then I think that's the main point I'd make.
Yeah, I would absolutely agree with that. Protecting those around you, and even the younger, those of you that have children under 5. We anticipate that there will be a vaccine for those children in the relatively near future, but right now there isn't. And one of the best ways to protect those children is in the same way, to have everyone around them vaccinated and protected so that they won't get disease either.
Thanks so much, Dr. Gross and Dr. Henderson, for talking a little bit about that. We will move on to the question and answer section, since really we want this to be the bulk of today's discussion. And we did get a question come through the chat not too long ago, and it also is very similar to a question that came through the registrations, is really wanting to learn more about the safety for children in getting the vaccine, for children under 11 who have asthma. Can you talk a little bit more about that?
Well, I can start with, as with many of the concerns about the vaccine, if my child has asthma, are they more likely to have a worsening of their asthma from the vaccine? Right now, there's really no evidence of that being a side effect of the vaccine. What we do know very clearly is that children with asthma are at much greater risk for having very severe illness if they get COVID. So if your child has asthma, the way to protect them is to give them the vaccine. They are much less likely to suffer a worsening of their asthma if they have the vaccine and avoid getting COVID than if they have asthma and get COVID and get much sicker than a child who got COVID who doesn't have asthma would. So I think that there's, again, very little evidence of serious long-term adverse effects from these vaccines, other than the ones that most people are familiar with: a sore arm, a fever, muscle aches and pains, and just feeling kind of crummy for a day or two, and then that goes away. The long-term side effects are quite rare, and in fact, even in children, with most vaccines, the significant side effects that we see generally occur in the first 5 or 6 weeks after getting a vaccine. So we've already been giving this vaccine with very, very close follow-up for longer than that period. And so the likelihood that some unknown bad thing result of the vaccine will come up is extremely, extremely small. The likelihood of bad things happening if you get the disease is very high. So I think that's the way you have to look at it.
I guess I would only add that we have a lot of experience with asthma in adults. And similar to what Dr. Gross said, people who get COVID with asthma are much more likely to be in intensive care and to die from COVID. So I work in a hospital with mostly adults. And so most of the patients we're seeing right now are actually patients who have not received the vaccine. And again, a risk factor for them doing poorly is any kind of lung disease. So asthma is one of those, but that's the most common one. And I would say, again, the side effects of the vaccine are very, very minimal. They're mostly a sore arm, or body aches, or this similar to the side effects in adults. In fact, in some ways, they're less significant.
Yeah, I think the bottom line is, if you have a child with asthma or any other sort of underlying condition, the way to protect them is to vaccinate them, not to be unvaccinated because you are worried about their disease, but their likelihood of suffering is much greater without the vaccine than with the vaccine. And I think that's the way you always have to look at these things. There's risk that you accept by being vaccinated, yes, there are very rare problems and there are fairly common mild problems, but there's very severe risk, significant risk that's much greater of something bad happening to your child by getting COVID itself. So the benefit of getting the vaccine hugely outweighs any possible risk from the vaccine.
Thanks so much for going deeper into that question. And there is also another question that came from registrations, is if children really need the vaccine despite the constant stage of COVID evolving.
Well, I think the state of COVID evolving at this point, what's happening is, I think if you look at the slide Dr. Gross showed about the cases, they're actually rising. So the pandemic right now is going into a 5th wave, meaning it's in our country going up. So I would say it's even more important to use vaccination as a tool to reduce the spread of COVID in a moment like this. I'm not sure I understand the question exactly. If that was the nature of it, it seems more important now, or it's important now as ever.
What was the question referring to, say, new variants, whether the vaccine would?
Yeah,
is that what it was getting at?
It wasn't specific with stating variants, but I would interpret it as that.
Okay. Well, I mean, that's a really important and a very good question. And it's actually one that right now we don't have all the answers to, but we have pretty good information. And what we do know is that with all of the variants, including this newest Omicron variant, the vaccines that we currently have are effective. Now, the variants may make it more likely that someone will be able to get infected, but the vaccinated people who get infected with any of the variants are much less likely to get seriously ill or die than the unvaccinated individuals. So it may be that right now, with the variants that are coming out, there's a greater risk, say, for your children or you to get the infection, but without the vaccine still offers a very significant protection against, number one, getting the disease, number two, transmitting the disease, and most importantly, getting seriously ill and having to go into the hospital or the intensive care unit or even dying. And I think that's the way we're going to have to live with this disease. This disease is going to be around for a long time, and there are going to be changes in the organism that we will have to respond to. But fortunately, the vaccines do seem to offer very good protection to all of these if you look at what's the likelihood that you will get very seriously ill or die.
Any other comments, Dr. Henderson? If not, I can go.
Yeah, I was just going to say that it really is a matter of, I put this in the chat, even with the variants, with the data we have so far with Omicron and with Delta, which is the most common variant in this country right now is Delta, you're about 10 times as likely to die from COVID if you're unvaccinated than if you are vaccinated. So, I mean, that's huge. I don't mean 10%, I mean 10 times. So that's, I don't even know how to put that in percentages, but it's just a huge difference. And I think a lot of parents are concerned about, people have heard about something called myocarditis, which is an inflammation around the heart, which can occur very rarely with this vaccine and many vaccines, but this vaccine, but it occurs after COVID at a rate that is 100 times greater than with the vaccine. So if you think about that, not 10 times, 100 times more likely to get this myocarditis from COVID infection than you are from the vaccine. And the few cases from the vaccine we've seen of this myocarditis, most have not required hospitalization. Most have resolved on their own. There's been no deaths. That basically, it's very mild. Unlike if you get myocarditis from COVID, which is much more serious.
Right. And the myocarditis is a significant issue. In the younger age group, there's been almost no cases of myocarditis, but I would totally agree with Dr. Henderson that it's like the other issues that we talked about. If you look at what's the risk of something bad happening to your child, if you say, well, something bad like myocarditis, then you would say keep them from getting COVID, because they're much, much, much more likely to have that bad thing happen in their heart from getting the disease than from the vaccine. So,
Yeah, thanks for that. There's also another question in the chat that was also talking about some of these reactions, and specifically wanting to know if there have been any immediate adverse reactions. And they put an example, including anaphylactic shock in children from receiving the COVID vaccine.
So the anaphylaxis is an allergic reaction which can occur from any treatment or medication. So there have definitely been cases of anaphylaxis from the vaccine, but they're on the order of 1 in 100,000. So the chances are 1 in 100,000. So we have given almost 50,000 vaccines at UC Davis, and we've not seen a single case of anaphylactic shock yet. So I think the answer is yes. And I definitely, it's possible, but it's extremely unlikely. And that's why when we give a vaccine, we watch people for 15 minutes, or if they have a history of an allergy, like if they've reacted to something else, we watch them for a longer period of time, because the chances are somewhat higher in someone who's had a lot of allergies. So the answer is yes, it can occur. It's extremely rare, and we're on guard for it. And then we can treat it. That's why we watch the kids after we give them a vaccine.
and this is not, again, as Dr. Henderson mentioned, not specific to a vaccine. This is the same kind of reaction if your child has a bee sting allergy or a severe food allergy, those same kind of reactions. But yeah, very, very rare. And even though they are that rare, those of us who are healthcare providers, we do not want to even have that 1 in a million happen. So we are there. We have the medications at every site with someone who is trained to administer them, and we're ready for that. Fortunately, we haven't seen that. There have been cases, and I think again, it's no different really than if your child gets an ear infection, and the doctor says, "Well, we have to put you on that pink medicine, that antibiotic." A very small percentage, probably in the same range as with the vaccine, will have an anaphylactic reaction, say, to an antibiotic. It's a risk that you accept. You say the benefit of treating that ear infection hugely, hugely outweighs the possible risk of having that reaction. And I think the same is true for the vaccine. The risk is tiny of something bad happening, and if it does, we can treat it. The benefit is massive in preventing the disease and all the complications of the disease.
Thank you, Dr. Gross. There's also
I just put in the chat the actual number. It's 3 per million. So for every 1 million doses of vaccine we've given to children, that is in the age group thus far, which is 12 to 18, there have been 3 cases per million. So that's, it's sort of as likely as winning the lottery if you would to have that. But again, as Dr. Gross said, we know how to treat that, and we have the medication at every time we give a vaccine.
Right. It's sometimes very difficult to put those risks in a perspective that you can understand. But the risk of having something very seriously bad happen to you from getting the vaccine is probably hundreds of times less than the risk that you exposed your child to simply driving them to the vaccination clinic, putting them in your car, the risk of you getting in a car accident. I mean, it's a real severe risk. We accept that risk because the benefit is you don't have to walk 10 miles to the clinic or whatever. But to put it in that perspective, you don't really worry that that's going to happen because it's very unusual. But it's way more common than a bad outcome from a vaccine by probably hundreds or thousands fold.
Thank you. Thank you for that. There is also another question wanting to know if there are certain pre-existing conditions that children might have that possibly they shouldn't get the vaccine because they have this or that. And what are those, if there are any?
I mean, Dr. Gross can speak to this. The main pre-existing condition is a severe allergic reaction to one of the components of the vaccine. And that the vaccine is made of something called polyethylene glycol. And that's the thing that it's like the liquid that it's in, but it's extremely rare to be allergic to that medication. So if your child happens to be allergic to that, again, it's much more common to be allergic to penicillin or one of the commonly prescribed antibiotics that we give than to be allergic to this substance. But I think if they have severe allergies, that's the biggest one I can think of. I don't know, Dr. Gross, if you have others in mind.
Yeah, they're really, besides a severe allergic reaction specifically to the first dose of the vaccine, there are no what we call contraindications. There are no reasons that would prohibit you from getting the vaccine. And the reason for that is the benefit of that vaccine is so great, and the likelihood of a serious problem from the vaccine is so small. So if you got the first dose in the series and had a true anaphylactic reaction, then we would say, no, you can't get that vaccine again. But simply an allergic reaction or a severe allergies to other things, allergic reactions are very, very specific. So the fact that you might have a severe allergy to penicillin really doesn't mean that you're at higher risk. But because we would be concerned, that's why we would watch you a little longer. We would say you need to stay for 30 minutes after, and we're going to watch you very closely, be able to intervene if something does happen in that scenario. But there's really no conditions, and most serious conditions that your child might have put them at much greater risk of something bad happening if they get COVID. So if they have underlying heart disease, kidney disease, liver disease, respiratory, whatever, their underlying medical problems mean if they do get COVID, it's much more likely to put them in the hospital or in the intensive care unit. So even if they have underlying medical conditions, most of the time, that's even greater reason to get the vaccine, not a reason to avoid the vaccine.
Thank you. Thank you for that, Dr. Gross. There is also some other questions and concerns of whether, if someone already had COVID, whether it's an adult or a child, do they still need the vaccine? And it's like a two-pronged question. Do they need it? And if they do, how long should they wait to receive it?
So that's a great question. Like, does getting COVID itself protect you from getting it again, like a vaccine would? I think initially people thought that might be the case, but now there have been a number of studies that have demonstrated that actually getting COVID does not protect you from getting it again. In fact, a vaccine seems to, the way your body protects yourself against infections is something called antibodies, which are they're proteins that Dr. Gross showed a little bit of this earlier. They're proteins that your body makes to recognize and then kill infections that come into your body. So the antibody levels, that's what we measure to know whether a vaccine is working. That's one of the ways. The antibody levels are higher when you get the vaccine oftentimes than they are when you get natural infection. There's been one study done that compares natural infection to vaccine, and then compares that to getting natural infection and vaccine. And it turns out getting infected with COVID and getting the vaccine are the most protected individuals. So that's better than getting either the vaccine or getting COVID alone. So the combination, now I'm not recommending that, but I am telling you that's why people who have had COVID, we definitely vaccinate them. We typically wait 1 month until after the COVID infection. Initially, we waited 2 months and 3 months, but we found with our experience as we've gone through this, that's probably waiting too long. And I think sometimes after getting an infection, you know, those antibodies, your immune system kind of falls off over time, and then you're able to catch it again. Honestly, that's why today we're giving booster shots, because over time, your immunity from the vaccine gets weaker. That's why boosters are needed. Now, that's not unusual at all. Almost most of the vaccines we give children and adults, they require boosters. Yeah. So the answer is yes, you need the vaccine after getting COVID infection. I think there was also a question about treatment of COVID. Some of the medications, ivermectin is a medication that's been used for a long time in the third world, in India in particular, for parasitic infections and worms, which are worms. That's like, it's very common in India. We don't see that in this country. But it turns out ivermectin also kills certain viruses, in particular Zika virus and something called yellow fever virus, which again, we don't really see in this country, in the United States. But that's why people thought that medication might work for COVID, which is also a virus. But the studies that have been done with that medication thus far don't show it to be effective in terms of treatment. There are a couple of treatments that have recently been approved, or they're not approved yet, but that actually show a lot of promise for treating COVID. Hydroxychloroquine, similarly, there's not much science behind that, but there have been some. It's very effective for something called malaria. Malaria is one of the most common infections in the world. We don't see it in the United States very much, but that's why people thought, because it kills malaria, that it might work against COVID-19. It turns out, when it's been studied rigorously, that it's not effective. So in fact, what we've seen is that the side effects of hydroxychloroquine outweigh the benefits, and the side effects are on the heart actually from hydroxychloroquine. So anyway, those two medications we're not using because we haven't seen any benefit to them when we studied them.
Yeah, I think, you know, there's a lot of optimism that could be had. People get kind of depressed when they're thinking about this whole pandemic and that there's no end to it and there's no hope. But there's a tremendous amount of research going on, and some of these new medications that Dr. Henderson mentioned look very promising, although they are taking someone who's already sick and trying to treat them. The real way to get around this is to prevent people from getting sick in the first place. And the way to do that is to vaccinate as many people as we possibly can, so that the likelihood that you or any of your children get exposed to somebody with the disease is very low. So vaccination really is a far superior way to keep you healthy than medication. But I think the treatments are coming down the pipeline, and there probably will be better and better treatments. And very likely, as we go forward, there may well be new variants of the virus that will require different treatments. And this is likely to evolve as the vaccines may evolve. And this may end up being kind of like the flu, where we all get a flu shot every year because the flu changes a little bit. And we just accept the fact that, okay, flu is here, we need to get the shot each year. It could be something like that with COVID. We don't really know yet. But what we do know is that the vaccine is very effective the way we're giving it, probably needs the boosters and may need, boosters as you go forward every year or few years. But preventing the disease is always better than letting the disease take hold and then trying to treat it, because no treatment is going to be perfect.
No, that is a very, very fair point. And there's also another question kind of relating to other immunizations. If does someone need to wait to get their child vaccinated with the COVID-19 vaccine if they recently got another vaccine recently?
Go ahead.
So, yeah, no, I wanted to make the most common vaccine that we give in conjunction with the COVID vaccine is the influenza vaccine that Dr. Gross just mentioned. I think the one thing I would say about COVID compared to influenza is COVID is a lot more serious and a lot more likely to kill you than influenza. They both can kill you. So they're both really serious, and they tend to affect, be worse in people with lung problems. So actually, I got my influenza shot and my COVID shot together. Now you might ask, well, wow, didn't you, how did it feel? Basically, you have two sore arms instead of one sore arm. And I think that's the main side effect of these patients is you get a sore arm. So no, there's no, again, in the initial months, we did not administer COVID vaccine with other vaccines because we were concerned there might be more side effects or cause problems, but it turns out none of those have actually turned out to be. So now it's the recommendation, and we give them together if possible. The reason is we need to give the flu vaccine before flu season starts for it to be effective, which is now.
Mm-hmm.
And this individual may have been asking the question in reference to other standard childhood vaccinations. And again, the same thing holds. Now, it's not really relevant yet because the vast majority of childhood immunizations occur starting at 2 months of age up until 5 years of age. And we're not vaccinating those kids yet. But the data is pretty clear. And I think once we start moving into that direction, that's one of the things that'll be looked at. But so far, what we've learned about giving multiple vaccinations is, it used to be that kids got one thing at a time, and now we give 7, 8 different vaccines at a time, many of them combined into a single shot. And we've learned that people can handle multiple different vaccinations at the same time. So I would say right now, if someone needed a tetanus shot or whatever, you could very safely get the COVID and the flu. There doesn't seem to be any problem with those. I suspect that will be the same case when we start immunizing very young children with the childhood vaccinations, but that's something that's part of the safety studies that these vaccines have to go through in the trials, where they will be giving them to young children who are getting vaccinated with other things and looking for possible problems. I don't think that's going to happen based on our experience with a lot of other vaccines. But that's a very good question.
Mm-hmm.
I
There was
see that.
another question in the chat, and also is similar to a question that came through in the in the registration about children who had blood issues or are taking blood thinners. How does the vaccine impact their state?
The issue, it sort of depends. It's a good question. It depends on what the blood issue is. If it's an immune disorder, like a problem with the immune system, which is, those are unusual, but they can occur. Like people have probably heard about Colin Powell, who died of COVID. He had an immune disorder. And so in immune disorders, vaccines, because they work by boosting your immune system, they don't tend to work very well. So in people with immune disorders, we actually need to give them more shots often. So the COVID vaccination in adults with immune disorders, we actually have to often give them 3 doses instead of 2 doses. So we don't know in kids yet, but I would say the standard vaccination is even more important, like Dr. Gross said earlier, in someone with an immune disorder, because their risk is higher of getting an infection like COVID. Now, blood thinners aren't a problem because you might worry about bleeding, but the needles we use, they're extremely small and they don't really cause bleeding. So you can be on blood thinners and get this injection, just as you can get most other vaccines while you're taking blood thinners. Now, if you were going to like take a tooth out or do something like some type of surgical procedure, of course that's a problem if you're taking blood thinners, but not this injection.
Thank you. Another question, and also somewhat of a comment. There's worry out there about the really long-term side effects for children who receive the vaccine as it relates to infertility or changes in menstruation cycles, and so there's potential reasons why parents don't want to vaccinate. Can you share a little bit about that?
Yeah, there's a lot of, the internet is a wonderful thing and we get a lot of great information, but it also tends to propagate ideas that really haven't been proven. And the vaccines that go into production, there's this idea that they weren't tested, enough. And that's really not true. What happened was these vaccines went through the same process of looking at safety and side effects as any of the vaccines. It just happened faster because of the massive amount of funding and push that happened. There is a reasonable discussion that you could say, well, we haven't had the vaccine that long. And so we don't really know if 10 years from now, we're going to see something. But what we do know is that we have histories of many, many, many other vaccines that have been studied extensively, and the likelihood of something showing up way down the road, it's very small. As I said before, the vast majority of vaccine side effects that we have seen occur in the first 5 weeks. So it is almost unheard of to have an adverse reaction to a vaccine occur years later. In the trials that have been done, there have been no data looking at that have suggested the reproductive problems with the menstrual cycle. There really haven't been anything other than the short term with the myocarditis and a few other very rare things, and the common side effects that Dr. Henderson talked about. So, we can't say absolutely that, gee, in 10 years, will we find out something? I would say we can't say 100% no, but we can probably say 99% no, because we have a huge amount of experience and this doesn't seem to happen.
I would add that, initially we did not vaccinate pregnant individuals because we were waiting to see whether there were problems. And because many individuals that turned out to be pregnant actually did receive the vaccine, oftentimes because they didn't know they were pregnant or they were early in their pregnancy, almost 200,000 pregnant women have now received the COVID vaccine in the United States. The numbers are higher in other countries, but so about 200,000 women have received the vaccine while pregnant. And as Dr. Gross said, there aren't really, the rates of a miscarriage or the rates of a stillbirth, they're not any higher than the normal rates for pregnant women in the United States. I would add to that, pregnant women who get COVID are more likely to have a stillbirth, are more likely to have a miscarriage than the normal rate of miscarriage and stillbirth in the normal population. So again, it's kind of like what Dr. Gross was saying earlier. If you get COVID and you're pregnant, you're actually putting your baby at higher risk than if you vaccinate yourself while pregnant. if that makes sense. The harms of the disease or the risks are much higher than the risks of the vaccine. We really haven't seen any. And I know that there was a lot out there about this. It's just not been really proven. And so like I said, it's worse to get the disease on the baby's health and on the pregnancy.
And one thing I think that most people don't know, and I'm gonna share my screen again and go to the last slide that I have, and it shows something that happens after a vaccine is licensed and what we do. And let me try this. And I'm just gonna this slide. What this shows is what we call post-licensure evaluation. So this is what happens after a vaccine starts to be given. One of them is this VAERS, Vaccine Adverse Event Reporting System. This is something that anyone can submit a report to. A parent can, a patient can, a healthcare provider. Something happens, they're not sure whether it was related to the vaccine or not, they report it. And then people look at this massive amount of data to try and decide, is there something that is now showing up years later that's very rare? This did happen once with a vaccine. It was licensed and it was approved, and it turned out that it was a very rare side effect, and it was picked up very quickly once millions of people started getting it, and there were these reports. There's another one called the Vaccine Safety Data Link. There are two networks here, and here we analyze side effects of giving a vaccine. One, the VSD gets information from 24 million people. PRISM, it's 190 million people that are part of this network. So the likelihood that some bad side effect is going to be missed is almost zero with these follow-up kinds of processes. And these are ongoing for all vaccines, including COVID. So, the likelihood, again, that we're going to miss something that happens down the road is very, very low, because it doesn't end with the government approving the use of the vaccine and sending it out. There's this massive, massive follow-up looking exactly for rare side effects and trying to determine. And of course, so far, there haven't been any, but this is going to continue for many years. So I think it's a way to be relatively safe that we're not going to miss something if it's there.
Thanks so much, Dr. Gross, for sharing those slides and explaining a little bit more about the resources that are available to everyone, and for potential opportunities to report any side effects down the line. I know we still have a few more minutes, and I do have a couple more questions. So also a message to folks who are still on, if you have any final questions, please make sure to put those in the Q&A so we can make sure that we address those in the next couple of minutes. There is a question that came in from registrations. If my child gets vaccinated, do they still need to wear a mask in public and in school?
That's a great question, and I wish I had a good answer to it, because it changes all the time. And I think it's one of the reasons that all of us are so frustrated, is that the rules keep changing, and sometimes they make sense and sometimes they don't make sense. And a lot of it is determined by the county that you live in. So I'm here in Davis, we're in Yolo County. The Yolo County Public Health Department makes those rules, and they are rapidly evolving. So a lot, and then even within that, the schools may have their own policies. So, some schools will say, if everybody gets vaccinated, then we could stop wearing masks. Most people right now, it's if you're indoors, the masks are still mandated. If you're outdoors and you're vaccinated, you don't have to wear a mask. That's the situation in Yolo County right now. And again, as the vaccine rolls out in children, very likely if we start seeing the effectiveness of the vaccine and the percentages of kids that get vaccinated, the masking policy may well change. But it's very confusing and very individualized and not always making the most sense.
But I would add to that I think wearing a mask is a different kind of protection than the vaccine. So the best analogy I can give you is that we wear a seatbelt when we drive, but we also, many of us have airbags in our car. They work differently. And so they both protect you. So that just doing one, just wearing a seatbelt, if you drive 80 miles an hour, doesn't protect you from getting in an accident, right? The seatbelt isn't foolproof. And so many times we use different types of protection. And right now, I think the safest way for you, if it were me, is, like Dr. Gross said, when I'm indoors with people I don't know, and I don't know their vaccination status, then I'm wearing a mask, even though I'm vaccinated with the booster. Now, once we get to a point where we know everyone is vaccinated, then that becomes a very different story. The problem is we don't know who's vaccinated and who's not. And so that's why wearing a mask indoors protects you when you're with other people that you don't know, and they could be unvaccinated. Again, I want to just emphasize the reservoir of COVID in this country and world is in the unvaccinated, mostly, not all, mostly. That's where it's sitting right now, and that's where you get it from. Even if you're vaccinated, you can get it from someone who's unvaccinated, is what I'm saying.
And speaking to that point, Dr. Gross and Dr. Henderson, is there any data talking about the difference in transmission rates in children versus adults or teens?
Yeah, there is. Teenagers, because as you all know, they're out and about in the world, so they tend to interact with each other a lot. And so it spreads via contact, being in close contact, being indoors with other people who are unvaccinated. So there tends to be a lot of spread amongst teens, both to each other. But again, as I said earlier, the thing we worry about most, and we've talked about this, the children who get sick are less likely to die, not impossible. As Dr. Gross said, almost 1,000 deaths in kids so far. And we expect there'll be more because the cases are rising. What we don't talk about is not the kids that don't die, but the kids that have long-term effects from COVID. So in adults, we see about 20% of people after COVID, they're better, they get better, but they still have lingering symptoms for months. They can't think straight. They're tired. Maybe they have trouble breathing. That's called the long COVID syndrome or post-COVID. That we're trying to prevent that as well. So I kind of got a little bit off your question there, but it's anyway, I think that the effects, the transmissibility. So Delta, we talk about Delta, the Delta variant, which is kind of the one we are dealing with most often, is definitely more contagious. That's why people who are vaccinated can catch it. Whereas the original strain, vaccinations seem to prevent them from even catching it. It now, like Dr. Gross said, it still prevents you from getting sick, which is the main point of vaccination. That's why we use a flu shot. The flu shot doesn't, and this is a common misconception. People think the flu shot protects you from getting the flu. That's not true. It protects you from getting sick and hospitalized and dying from the flu. That's what we want it to do. But it doesn't prevent, it doesn't prevent you from catching it. Now, masks can prevent you from catching it. So I'm going to tell a brief story. Last year at UC Davis Medical Center, because people were wearing masks, we didn't see a single case of the flu, not one. I've never been here for 22 years working in this hospital. I've never seen that happen, not a single case of the flu. Why? Masks. So, I mean, I think both are important, vaccines and masks, if you want to protect yourself.
Right. And I think the other thing that's most people have heard, but it enters into this whole issue of how to protect everyone. And that is that, especially in children, a significant number that get infected with COVID don't get any symptoms. So, an adult that gets sick and gets a fever and has a cough, they're probably going to get tested and it'll be recognized and they'll get isolated. Whereas children are more likely to have an infection, but no symptoms whatsoever, but they're still transmitting the COVID. So that's one of the problems with trying to identify who might be transmitting. And that's why we have these policies where if there's no absolute mandated vaccination, and you don't know who's vaccinated and who isn't, you can't tell by who is sick and who isn't sick. And so that requires a lot more kind of vigilance in terms of the protection. And again, that's why most of us in the medical field feel the more we can vaccinate, the better, because that reduces that population of people who are carrying that COVID, and we can't have any way of knowing until they infect someone who really does get sick. So like Dr. Henderson was saying, your child who may get it has no symptoms, comes home, and great grandma is there for Christmas, who is 90 years old and has a number of underlying problems, and she gets it from you or your child, even though they weren't sick at all, and she ends up getting sick and dying. And so it makes it more complicated in that we have these kids who really are completely healthy, but they do have the virus and they can spread it.
Thank you, Dr. Gross, Dr. Henderson. We're getting towards the end of our time together, and I just want to turn it back over to you both. And if there's one, final message or a couple of sentences that you'd like to share with folks who are joining us today, just to culminate the discussion that we've had, we would love to hear those final thoughts.
Well, I'll give you my final thought, and that is, I'm a pediatrician. I went into pediatrics really for one reason, and that is to improve the health of children and to keep children healthy and try and keep them from getting sick, as well as treating them when they do get sick. And I feel it's absolutely part of my responsibility to do everything I can to convince people that vaccinating their children is part of keeping them healthy. And I think, unfortunately, there's been so much concern and difference of opinion and political views come into this that we've lost sight of the fact that most of us in medicine, what we care about is really helping people either not get sick or get better when they do get sick. And when we look at that and we say, look, we've got something now that really can help us do that, then I would say, anything that I can do to convince you that that's in the best interest of you and your children, then that's what I'm all about. I want to keep those kids healthy and safe.
Yeah, I amen to that. I guess I would say that I would encourage you all to ask questions like you did tonight to someone who's a healthcare professional, like your pediatrician, or like your if you have an adult, if you have a physician, someone who's a healthcare professional, who, because there's a lot of information out there, and I think Dr. Gross said this earlier, a lot of it's not, I don't think it's trustworthy. I think for whatever reason, I don't understand the reasons, but sometimes there's information out there that actually people are putting out there for, I don't know, their own personal reasons or something, but it's not based on science. And science, the reason I went into medicine was science. When I was a kid, my favorite kind of uncle that kind of helped raise me had polio, so he couldn't walk. But at the time when I was a small child, they had vaccines the vaccine for polio was a miracle. There's people who could catch polio, which you could spread. You could get it at a swimming pool. You could spread it. It's like, to me, it reminds me of COVID. you could get sick, you get paralyzed. You usually wouldn't die. You could die, but you usually get paralyzed. But vaccination completely changed that for us. In fact, it changed the world. So polio, you know, almost eradicated from the world now. Eradicate, like you don't see it anymore. And the only reason is vaccination. Yet I think people now are throwing stones or calling into question that vaccines are helpful. And again, so I would just urge you to ask someone that you think is, you know, if your car is broken, you take it to a mechanic, right? If your toilet's broken, you call a plumber. I think if you're sick or if you have a question about a vaccine or a medication, you go to a doctor or someone that's a healthcare professional. But that is not where people are going to get their information. And I think that is leading some people astray, and it's costing some people their lives.
Yeah, there's no underlying conspiracy among healthcare providers. I don't get any benefit personally, financially, in any way, whether every one of my patients gets vaccinated or none of them gets vaccinated. I do it because I care about their health and I take responsibility for that. That's why I do it. It's not because of drug companies making lots of money or me getting benefit from it. It's for almost all physicians, they're doing it because our oath basically is to do everything we can to help people. And I think vaccination is one of the most important things that we can do.
Yeah, and you know, and again, and we'll also share some resources in just a moment here. If you are in need of vaccinations for folks that live in Placer County, there are some opportunities this upcoming week. One on Friday, it's actually hosted by Health Education Council at the First United Methodist Church in Roseville, and a couple other opportunities happening through the weekend. So there will be professionals there that can, you bring your questions if you still would like to talk to someone, or next slide, Michaela. Or if you still have other questions, please contact us. We have a phone number. You can also reach us via text message. Again, if you don't live in Placer County, want to know a little bit more about where you can go, a clinic, a local pop-up vaccination event that's happening in your area, or still have those questions, you know, we can make sure that we can answer those for you and further help you navigate where to go and answer those questions. I will also share that we do have messages that we're constantly posting on our social media pages on Instagram and Facebook, and you can follow us at Health Ed Council. And that concludes our town hall today, and I want to give such a warm thanks to Dr. Gross and Dr. Henderson for your time, for answering everyone's questions. Thank you to all the attendees who have joined us this evening and for posting your questions before or during the session today. I learned a lot, and I hope that you all learned a lot too, that hopefully you can share that information that you've learned with others, and just make sure that we are all staying safe. So with that, we will end the discussion today, and we hope that everyone has a great rest of your evening, and happy holidays to you all.
All right. Take care, everybody.
Thank you so much.
Bye now.
Bye.